and thank you for visiting my poster. My name is Catherine, and I'm a toxicologist at the n-Lorem Foundation. At n-Lorem, patient safety is the foundation of our discovery and development process. The development of optimal experimental ASOs depends on achieving excellent safety profiles, guided by rigorous tolerability and toxicology assessments throughout. This poster presents n-Lorem's comprehensive preclinical development approach for creating well-tolerated ASOs with favorable toxicology profiles intended for CNS, intrathecal, systemic, subcutaneous, and ocular intravitreal administration, including standard class-related in vivo findings, the primary types of toxicities encountered, and key safety considerations at each stage of development. For CNS indications, ASOs are administered by intrathecal injection in the patient. As such, we use the same route of administration in the preclinical studies, including an initial non-GLP 8-week single intrathecal dose tolerability study in rats. The purpose of this study is to screen and evaluate the tolerability of ASO candidates following a single intrathecal injection in rats over an 8-week observation period, where animals are administered a single high dose of ASO on day 1 and monitored for acute neurobehavioral findings at 3 and 24 hours post-dose, using a 7-tiered Parisien scoring system, where the increase in score indicates an increase in severity. Transient high limb paresis is a common ASO-related finding following intrathecal administration, and scores of 3 and below are considered well tolerated if absent by 24 hours post-dose. Animals are then scored once weekly for 8 weeks to monitor for any delayed effects, along with general clinical observations and body weights. Any delayed findings, such as hind limb weakness or paralysis, is considered unacceptable, as well as a decrease in body weight and/or mean body weight when compared to controls. At the end of the 8-week observation period, brain and spinal cord tissues are collected for postmortem analysis of tolerability markers by mRNA and immunohistochemistry analysis for neuroinflammation and cytotoxicity, including astrogliosis, microgliosis, and Purkinje cell loss. ASOs demonstrating neuroinflammation or cytotoxicity are considered not tolerated. Following a review of all screening data, a lead ASO is selected and evaluated for its potential toxicity and a no observed adverse effect level, no-EL, in a GLP-compliant 13-week repeat intrathecal dose tox study in rats. In this study, animals are dosed once monthly for 4 months and are assessed at 4 and 24 hours post-dose using a comprehensive neurobehavioral exam and monitored for general clinical signs, body weights, and food consumption over the study duration. Common ASO-related findings may include transient slight sedation and paresis at 4 hours post-dose, which is absent by 24 hours post-dose, and/or decreases in mean body weights when compared to controls, and that could possibly correlate to sporadic decreases in food consumption. An ophthalmology exam is performed at the end of the study, as well as clinical pathology analysis. There are no ocular findings following intrathecal administration of ASOs, and rarely effects in clinical pathology parameters. A week following the last dosing occasion, necropsies are performed and tissues collected for anatomic pathology and bioanalysis. ASO administration generally does not result in any organ weight changes or gross findings. Bioanalysis of the CNS tissues revealed dose-dependent increases in tissue concentration of ASOs, which confirms exposure in target organs. Finally, histopathology findings associated with the uptake and accumulation of ASOs include vacuolated macrophages in CNS tissues, as indicated in Figure A here in the brain, basophilic granules in renal tubule epithelial cells of the kidney, as shown in Figure B, and nerve fiber degeneration of the nerve roots, shown here in Figure C. Following a review of all data, the no-EL is confirmed, providing sufficient safety margins to the clinic. For kidney and liver indications, ASOs are administered by subcutaneous injection in the patients. As such, we use the same route of administration in the preclinical safety studies, including a non-GLP 8-week repeat subcutaneous dose tolerability study in mice. The purpose of this study is to screen and evaluate the tolerability of ASO candidates following repeat subcutaneous injections in mice over 8 weeks. During this study, animals are monitored for general clinical observations and body weight changes. Clinical observations are rare, however, can include jaundice, which is yellowing of the skin and/or eyes due to excess of bilirubin in the blood. Body weight losses or decreases in mean body weights when compared to controls are common and are considered not tolerated. At the end of the study, clinical pathology analysis is performed. Common clinical chemistry findings of systemically administered ASOs include increases in liver enzymes such as ALT and AST, as well as increases in bilirubin, GGT, and ALP. Kidney parameters such as blood urea nitrogen or creatinine may also be elevated. Organ weights may also be increased, including liver and spleen, correlating to clinical chemistry and histopathology findings. Depending on the severity, the aforementioned findings may be considered not tolerated. Following review of all screening data, a lead ASO is selected and evaluated for potential toxicity and a NOEL in a GLP-compliant 13-week repeat subcutaneous dose tox study in mice. In this study, animals are observed for clinical observations, body weights, and food consumption, and it's rare to see ASO-related changes in these endpoints, as ASOs with these effects would have been eliminated following the tolerability screening study. At the end of the 13 weeks, clinical chemistry and hematology analysis is performed, where common ASO-related effects include possible elevations in liver and kidney markers, such as ALT and AST, as previously demonstrated, and hematology effects correlating to a pro-inflammatory response of the ASO, for example, increases in absolute neutrophils, monocytes, and eosinophils. Analysis of ASO concentration in kidney and liver tissues demonstrate a dose-dependent increase and confirms ASO exposure in target tissues. Clinical pathology effects may correlate to histopathology findings in the liver, including single-cell necrosis, basophilic granules in Kupffer cells, mononuclear cell infiltration, hepatocyte karyomegaly, and or possibly increased mitotic activity. Now, in the kidney, common ASO-related findings include basophilic granules and vacuolation in tubular epithelial cells. Finally, an increased cellularity in the spleen may be observed. Following review of all data, a NOEL is confirmed, providing sufficient safety margins to the clinic. For ocular indications, ASOs are administered by intravitreal injection in the patients. As such, we use the same route of administration in the preclinical safety studies, including a 2-week single intravitreal dose tolerability study in monkeys. The purpose of this study is to screen and evaluate the tolerability of ASO candidates following a single intravitreal injection in monkeys over a 2-week observation period, where ophthalmology exams are performed at 24 hours, 1 week, and 2 weeks post-dose. The ophthalmology exam consists of a slit lamp exam, which uses bright light to examine the eyelids, cornea, conjunctiva, sclera, iris, lens, and retina, and a fundoscopic exam used to visualize the retina, optic nerve, and blood vessels. Common ASO-related ophthalmology findings are reflective of the pro-inflammatory effect of ASOs and include anterior chamber inflammation, as demonstrated here by anterior chamber cells, as well as hazy view of the fundus, fibrin, keratotic precipitates, decreased pupillary reaction, and flare. Animals also may experience vitreous inflammation, including vitreous cell-like opacities, vitreous haze, and finally, findings associated in the iris include miosis and irregular margin. Following review of all screening data, a lead ASO is selected and evaluated for potential toxicity and a NOEL in a GLP-compliant 14-week repeat intravitreal dose toxicity study in monkeys. In this study, animals are once again routinely observed for ophthalmology findings, such as ocular inflammation, as previously described, and intraocular pressure is also measured on these occasions, with possible decreases correlating to ocular inflammation. In addition, an ERG exam is performed to measure retinal function. Abnormalities in ERG parameters may correlate to any observed ocular inflammation. Common histopathology findings of ASOs administered by IVT injection also correlate to possible ocular inflammation and include vacuolated macrophages and mononuclear cell infiltration in various components, as well as fibrin deposition and fibrosis in the vitreous chamber and single-cell necrosis in the retina. Following review of all data, a NOEL is confirmed, providing sufficient safety margins to the clinic. This work summarizes the standard ASO-related toxicities following intrathecal, subcutaneous, and intravitreal delivery and outlines n-Lorem's rigorous safety assessment methodologies used to fully characterize these findings. Together, these efforts reaffirm n-Lorem's unwavering commitment to ensuring every ASO delivered to patients is safe and well tolerated. Finally, I would like to thank all of our CROs, partners, and the whole n-Lorem team who are making this work possible. Thank you.